Today, a focus on a genetic heart condition that affects an estimated 50,000 Americans, both men and women equally. Here is how doctors identify and help patients fight this potentially deadly condition.
Ready?
When Tara Cortez's husband Ozzy was diagnosed with Marfan syndrome in 2015, the couple wasn't actually that surprised.
It wasn't a shocker. It was more like it was just a confirmation.
It's my mom.
Their oldest son, Zayden, also tested positive for the same gene mutation. Their youngest son, Xavier, did not.
When we decided to have children, we knew there was a 50-50 chance of them coming out with Marfan syndrome. But it was a risk we were willing to take.
Dr. Roman Yusupov, medical geneticist and director of the Marfan Clinic at Joe DiMaggio Children's Hospital, says the condition is a connective tissue disorder that can cause an enlargement of the aorta.
And you don't know about it because you don't have any symptoms. But unfortunately, it may create an aneurysm and it can rupture, causing sudden death.
The doctor says Marfan syndrome happens in 1 out of every 20,000 births, equally in all races and ethnic groups.
If there is family history, genetic testing can be done even prenatally or a newborn baby. But frequently, we discover that somebody may have Marfan syndrome after about 5 years of age or older, in adolescence.
That's when the external signs of Marfan syndrome become more evident, including long limbs.
So I'm bigger than every other 7-year-old.
Ozzy has gone through 4 open heart surgeries, and he and Tara are hoping that early intervention will help Zayden avoid similar serious complications.
At 7, his aorta is already large. At 5, it was the size of a 12-year-old's.
Along with routine doctor visits and diagnostic testing, Zayden takes daily medication to slow down the growth of his aorta.
I have to take medicine every day, and I put my pills in my chocolate because my pills taste very nasty.
We're trying to stop all the things that Dad has had to go through, which he's lucky to be here today. We're trying to stop all those things from happening to our son.
And research that could lead to a cure for Marfan syndrome is advancing rapidly, thanks in part to money raised for research during the annual Marfan Walk in May. Local 10 always participates in that. So to find out more on how to support that effort, look for this story in the health section of local10.com.